The Veterans Health Administration is America's largest integrated healthcare system, providing care in 1,200 healthcare facilities, including medical centers and outpatient sites of care of varying complexity, serving 9 million enrolled veterans each year. The Clement J. Zablocki VA is one of 170 medical centers in this system. Located on the western edge of Milwaukee, Wisconsin, on 245 acres, Zablocki is a vibrant Class 1A VHA medical center, meaning highest complexity, delivering primary, secondary, and tertiary medical care to eligible veterans in 196 acute care beds. The community living centers provide long-term care with 113 operating beds, offering geriatric programming intended to preserve and enhance dignity for individual veterans. Zablocki VA Medical Center serves a veteran population of roughly 250,000 in southeastern and east central Wisconsin. It is the parent facility for a community-based outpatient clinic in Union Grove, serving veterans south of Milwaukee, and the northeastern Wisconsin ambulatory care clinics, which consist of the Green Bay Health Care Center, Appleton, and Cleveland, Wisconsin clinics. This virtual tour will describe the areas where nursing care is provided at the Zablocki VA Medical Center. The acute care division encompasses 6 inpatient units, from medical surgical to ICU. 4C is a 30-bed acute medicine and hematology oncology inpatient unit with 20 beds designated for acute medicine and 10 beds for the oncology population. Of the 30 patient rooms, 26 are private rooms and 2 are double rooms. Basic telemetry monitoring can be provided for up to 16 patients. The unit also has the ability to monitor 4 patients in negative airflow isolation. Observation level of care can be provided. The average length of stay is 4 to 5 days. Common admitting diagnoses include heart failure, chronic obstructive pulmonary disease, stroke, GI, respiratory or renal disease, mental status changes, or complications related to cancer and hematological disorders. 4C is the only inpatient unit that administers chemotherapy and biotherapy agents. Nurses with a passion for oncology can elect to receive training to safely administer chemotherapy and biotherapy agents and provide care to this unique patient population. Oncology nurses collaborate with staff in the outpatient oncology and radiation clinics to ensure seamless care. Physician team offices are located on the unit, including the inpatient oncology and 4 medical teams that admit to the facility. 4C has 2 dedicated social workers, a discharge pharmacist, and dietitian to help facilitate care needs and discharge planning. The unit is fast-paced and patient turnover can be high, but nurses learn critical multitasking and prioritizing skills as they become part of a proud and committed team that cares for a diverse veteran population. 4C values teamwork and a healthy work environment. The unit is recognized as a Silver Beacon Award for Excellence by the American Association of Critical Care Nurses. Staff is expected to be active in quality improvement initiatives to continually improve the care provided, so change is constant. 4C has a strong shared governance structure and have staff involved in many division and medical center-wide councils. 5C North is a 15-bed acute medical surgical telemetry unit providing complex care to primarily cardiology and cardiothoracic patients. Patients undergo diagnostic procedures including stress tests, cardiac catheterization with or without interventions, electrophysiology studies, placement of implant devices including pacemakers and defibrillators, and other procedures such as ablations. A chest pain protocol is utilized to allow a patient to be in an observational status, providing comprehensive care, including testing and treatment within 23 hours. The cardiothoracic patient may come to the unit after initial recovery in the ICU and includes all cardiac open heart as well as any other surgery on the lungs or chest. 5C registered nurses are able to administer continuous intravenous cardiac medications such as amiodarone, diltiazem, dobutamine, furosemide, lidocaine, milrinone, nitroglycerin, and procainamide, which require close monitoring. All registered nurses are ACLS certified. The central telemetry station for the medical center is located on this unit, providing monitoring for 5C North, as well as remote monitoring on 4C, 6C North, 6C South, 7C, and the Iron Mountain VA. All 5C North staff achieve and maintain telemetry competence as well as telemetry station monitoring competence. 6C North is a 17-bed medical surgical unit. The unit has the ability to provide negative isolation care in 2 rooms. The average length of stay is 2 to 3 days. Admitting diagnoses include chronic obstructive pulmonary disease, heart failure, cellulitis, substance abuse, stroke, GI, renal disease, mental status changes, and GU post-op procedures. Telemetry, if indicated, can be provided to any patient on the unit. 60 North is a fast-paced unit with a high patient turnover, which builds a great team atmosphere on all 3 shifts. 7C is a 30-bed unit providing a comprehensive interdisciplinary approach in the care of both medical and surgical patients. Postoperative surgical patients comprise approximately 50% of the unit population and can come from specialties such as general surgery, orthopedics, vascular, GI, GU, neurosurgery. The role of the RN on this unit requires the utilization of the nursing process to assess, diagnose, treat, and evaluate the veteran to optimize treatment and recovery. Effective communication, teamwork, and multidisciplinary care is essential to provide a high level of care and produce effective outcomes within this patient population. 60 South is an 11-bed progressive care unit. Progressive care is a level of care established to bridge the gap between the intensive care and in medical surgical units with a goal of providing a higher intensity of patient care and or higher level of nursing surveillance than possible on a general medical surgical unit. Care is provided to the veteran population who has a variety of medical issues or has undergone recent surgical procedures. Patients admitted to the PCU are hemodynamically stable but have a high potential for increased intensity of nursing care with less complexity than the intensive care unit level. Nursing surveillance in the PCU may require frequent monitoring of vital signs. During the COVID pandemic, this unit serves as the COVID unit for critical care and med-surg patients with COVID-19. The 18-bed intensive care unit is a closed unit whereby the medical ICU or surgical ICU team manage the ICU patients in collaboration with the primary medicine or surgery service. Common medical diagnoses admitted by the MICU team include acute respiratory failure, sepsis, acute coronary syndrome, pneumonia, chronic obstructive pulmonary disease, diabetic ketoacidosis, and drug or alcohol withdrawal. Common surgical procedures admitted by the SICU team include coronary artery bypass surgery, valve replacement, video-assisted thoracoscopic surgery, thoracotomy, thoracic and abdominal aneurysm repair, vascular fem-pop bypass, and carotid endarterectomy. Care of the critically ill veteran may include the following types of therapy: mechanical ventilation, initiation and titration of multiple high-risk medications including insulin, inotropes, vasopressors, antiarrhythmics, anticoagulation, sedatives, narcotics. Other therapies include continuous renal replacement therapy, intra-aortic balloon pump, pulmonary artery catheters, nitric oxide therapy, hypothermia, and intracranial pressure monitoring. Rehabilitation Extended Care Community Division. 9A, Valor Point, located within the Community Living Center, is a 40-bed unit consisting of 3 programs: Transitional Care, Geriatric Evaluation Management, and Comprehensive Integrated Inpatient Rehabilitation Program. Transitional Care, with 19 beds, is a short-stay, interdisciplinary program, typically less than 90 days, which serves medically stable veterans and provides nursing and medical care prior to their return to the community setting. This program provides wound care, IV therapy, total parental nutrition, respiratory care, as well as veteran and family education. Veterans awaiting Title 19 approval or guardianship are also admitted here. Geriatric Evaluation Management with 10 beds is your short stay program, less than 30 days, which provides an interdisciplinary team assessment and plan of care to assist in maintaining the geriatric veteran in the community. Veterans must be 65 years of age or older, be medically stable, but have multiple medical, functional, and psychosocial problems that could benefit from a team assessment. The Comprehensive Integrated Inpatient Rehabilitation Program, with 11 beds, is an acute care inpatient rehabilitation program providing comprehensive care by an interdisciplinary team to maximize function and abilities. This program provides an opportunity for appropriate veterans to improve deficits in mobility, self-care, or safety concerns with attainable goals. The length of stay is determined by the goals of care. Nursing care provided is veteran-focused and uses a team model. The patient population is dynamic and complex, providing opportunities for nursing staff to experience a vast amount of diagnoses and enhance assessment skills. 9C, Independence Hall, is a 22-bed unit with 16 beds occupied with long-term care veterans and 6 beds occupied with transitional care veterans. Serving a very diverse population, 9C South residents are challenged with complex medical issues, including but not limited to multiple sclerosis, Huntington's disease, amyotrophic lateral sclerosis or ALS, spinal cord injury, diabetes, cardiac disease, and heart failure. Residents may have mental health issues including post-traumatic stress disorder, anxiety, or dementia. The unit staff works closely with all members of the interdisciplinary team to provide veterans with optimal care. This is the veteran's home, and the care delivered is resident-centered and honors individual needs and preferences. Veterans remain on the unit for many medical challenges, IVs and transfusions, avoiding the disruption of transfer to the acute units. The veterans are actively involved in many activities, and staff enjoy the long-term relations with the veterans as they work together to plan their care. 9C North. Heroes Corners is an 18-bed palliative care hospice unit. The nursing staff provides high-quality, patient-centered care to veterans and their families. Collaborative care is provided and supported at end of life, as well as supportive care while veterans are receiving palliative chemotherapy and/or radiation. Nursing staff focuses on management of symptoms including pain, provision of psychosocial and spiritual support, and the application of comfort measures as an alternative to aggressive treatments. The community homes serve our long-term veterans in a home-like setting. There are a total of 3 homes, and each is the home to 10 residents. 2 are long-term stay homes, and the third is short stay, less than 90 days. The homes are surrounded by trees. Each home has a functional kitchen that allows for veterans to have home-cooked meals. Residents stay engaged with phenomenal recreational therapists. The OR consists of 8 rooms. The surgical specialties include cardiac, thoracic, general, neurosurgery, oral surgery, plastics, urology, gynecology, ophthalmic, ENT, orthopedics, vascular, and robotics. The OR staff consists of registered nurses and surgical technicians working collaboratively with surgeons, anesthesiologists, nurse anesthetists, and anesthesia technicians. Hours of operation are 7 a.m. to 5:30 p.m. Monday through Friday, and service is provided 24/7 with on-call staff. Registered nurses perform both scrub and circulating roles. Orientation is structured to mastering each specialty before moving on to the next. The OR has a clinical nurse specialist to assist with orientation, continuing education, and performance improvement within the perioperative area. OR nursing is fast-paced and highly technical, but very rewarding. OR nurses serve as a patient advocate during the phase of care when the patient is most vulnerable and cannot speak for themselves. The emergency department, with 19 beds and 24,000 annual visits, provides care for veterans experiencing medical, mental health, and social emergencies. The nurse-patient ratio is in alignment with the Emergency Nurses Association guidelines and is generally 1 nurse to 3 patients. Nurses use the Agency for Healthcare Research and Quality Emergency Severity Index triage scoring system, a 5-level emergency department triage algorithm that provides clinically relevant stratification of patients into 5 groups from least to most urgent based on patient acuity and resource needs. Nurses in the emergency department work in an interdisciplinary team-based model designed to optimize patient care and flow. The outpatient surgical clinic consists of 16 subspecialty clinics including wound care, audiology, ENT, general surgery, plastic surgery, cardiac surgery, thoracic surgery, neurosurgery, orthopedic surgery, vascular surgery, ophthalmology, optometry, coordinated outpatient testing center, and pre-surgical evaluation. Overall, the surgical clinics cared for 133,000 veterans in 2019. Nursing truly provides the base of operations within the surgical clinics. There are nurse practitioners and nurse facilitators for each subspecialty. The nurse facilitators for each clinic coordinate clinical care, manage clinic flow, and expedite scheduling and case manage surgical cases throughout the surgical experience. The nurse-driven COTC, Coordinated Outpatient Testing Center Clinic, which served over 5,000 veterans in 2019, coordinates care of complex patients who require procedures, testing, and surgery. The Surgical Care Division has 4 certified wound, ostomy, and continence nurses who staff the outpatient wound clinic, as well as providing consultative care to all inpatient units. Clinic nurses assist in a wide variety of roles based on the needs of each specialty clinic. Such responsibilities include, but are not limited to, providing pre-op and pre-procedure education, suture and staple removal, cast applications and removal, instilling treatments for bladder cancer, Foley and suprapubic catheter changes, performing earwax removal, complex dressing changes, applying compression wraps, assisting with joint injections, assisting with minor surgical procedures, performing blood draws and EKGs, follow-up on lab tests, and triaging telephone calls in addressing veterans' concerns and questions. In August 2019, the surgical clinics moved to a new state-of-the-art clinic space on 8th floor, providing improved access and efficiency for veteran care. Clinic nurses are actively involved in shared governance. The surgical clinic staff are committed to nursing excellence, have consistently placed in the top 3 winners during the annual hospital-wide performance improvement fair. A tracking board displayed in the clinic space focuses on current PI projects. Cardiac catheterization and electrophysiology labs. The Cath EP labs are located on the 5th floor, adjacent to the Acute Care Cardiac Inpatient Unit. The labs are staffed by a combination of either Cath or EP physician, nurses, and cardiovascular technicians. In the Cath lab, patients undergo both diagnostic catheterizations as well as interventions as needed. Emergent cardiac services are available 24/7 through an on-call team. In the EP lab, patients undergo a variety of procedures, including both radiofrequency as well as cryoablations, pacemaker and cardiac defibrillator implants, temporary pacemakers, insertable cardiac monitor implants, laser lead revisions, and explants. Staff is cross-trained to provide comprehensive, high-quality, veteran-centered care in both labs. Nursing staff typically have 2 to 3 years previous experience in critical care nursing and perform moderate sedation, circulation, or with advanced training, function in the scrub role. The cardiovascular technicians are highly specialized in monitoring patients during procedures, as well as working in the scrub role with advanced understanding of both equipment and supplies. The medical subspecialty clinics are comprised of many services. Clinics coordinated include allergy, endocrine, cardiology, arrhythmia, pulmonary, sleep, infectious disease, nephrology, GI, rheumatology, hepatology, palliative care, dermatology, neurology, and physical medicine and rehab. Diabetic nurse educators are also part of the team, seeing both inpatients and outpatients, as well as teaching diabetic education classes. Their program is recognized as a Center of Excellence with the American Diabetes Association. The ALS Interdisciplinary Clinic is held twice monthly and has received national recognition as a Certified Treatment of Excellence by the National ALS Association. Veterans coming to the clinics for their provider visits and exams comprise only a part of what happens in a medical subspecialty clinic. In 2019, there were 63,000 nursing interventions. Most of the RN care coordination happens behind the scenes. Nursing responsibilities include triaging consults, coordinating urgent face-to-face appointments, answering veteran telephone calls and secure messaging, provider communication and coordination of clinics, clinic injections and immunizations, patient teaching, and coordinating care between healthcare partners at Froedtert and Medical College of Wisconsin for dermatology procedures and surgeries. Medicine providers and nursing collaborate extensively on multiple levels to ensure the needs of the patient are met. Women's health for veterans include a total and comprehensive care package, including a primary care clinic that is a one-stop source for screening, preventive services, and resources within the VA. Women's Health Services collaborates with community care for maternity and mammography services. The clinic offers comprehensive breast care, including breast cancer risk assessment and surgical and oncology breast cancer treatment. Gynecological services include cervical screening with follow-up, infertility treatment, contraception, and pre-contraception care. In addition, there is a sexual health clinic, pelvic floor therapy, and a women's health resource center offering clinical and mental health services in a building separate from the main hospital. Women's Health also has a postdoctoral fellowship for physicians, nurses, psychologists, and other disciplines. Primary care clinics are made up of many patient-aligned care teams, known as PACT, that consist of different healthcare professions to plan for the whole person care and lifelong health and wellness. They focus on partnership with veterans, access to care using diverse methods, coordinated care among team members, and team-based care with veterans as the center of their PACT. The primary care registered nurse care manager has many roles and responsibilities with a patient load of approximately 1,000 veterans per team. The RN is the point person on the team and links the veterans with resources referrals to specialty services. They also coordinate resources for comprehensive care to avoid duplication of services and streamline staff interaction with the veteran. The registered nurse provides intensive case management of diseases such as diabetes, hypertension, and heart failure. They coordinate face-to-face, telehealth, and telephone appointments for care management, providing education and assistance for veterans with suboptimal control of chronic health issues and other issues as appropriate. The emphasis is always focused on prevention and health promotion. Mental health. 3C is a 34-bed locked inpatient mental health unit serving veterans with a variety of mental illnesses, drug and alcohol addictions, and dementia. Suicidal patients require close monitoring. 3C has a large bank of cameras that are continuously monitored. In addition, 15-minute rounds are completed on all patients. The average length of stay is 3 to 5 days. The inpatient mental health unit specializes in the recovery-based model of treatment. Individualized treatment planning is done with a multidisciplinary approach. Group therapy is accomplished by various disciplines leading groups, including, but not limited to, occupational therapist, music therapist, social work, psychologist, psychiatrist, registered nurses, and the nursing assistant. External entities that are also based on the recovery model, such as Alcoholics Anonymous, Narcotics Anonymous, the National Alliance on Mental Illness, and American Legion, also facilitate groups on the unit. In addition to the 34-bed inpatient unit, the 125 operating domiciliary beds are the locus of several innovative residential treatment programs, including an alcohol drug rehab program, a post-traumatic stress disorder treatment program, a general rehabilitation and treatment for veterans with chronic mental health problems, and a program specifically designed for individuals with dual diagnosis of substance use and another primary mental health diagnosis. The Milwaukee Spinal Cord Injury Disorder Unit is one of 25 centers across the nation. Spinal cord injury delivers care to over 400 veterans, which includes acute rehabilitation, primary and chronic care, respite, lodging, and end of life. The 38-bed unit is equipped with ventilator capability, sleep study management, environmental control units, and an apartment to best prepare a new injury for discharge back to the community. Outpatient services include primary and chronic care, backlift and pump refills, acupuncture, healing touch, wound management, home care, and telehealth. Any spinal cord injury veteran in long-term care within a 100-mile radius is monitored on a quarterly basis. This concludes our virtual tour of the settings in which nursing care is provided at the Clement J. Zablocki VA Medical Center.